Dr. Shafiqur, what exactly is vertigo or dizziness? Are they same? Are they different for common people's understanding?
About 95% patients around will be simple dizziness,
Okay.
whereas 5% patients may turn out to be having some problems related to brain or sometimes heart and sometimes ear related issues.
Stress or anxiety are associated with dizziness or vertigo. So, is it a fact or is it just the part of the stress or anxiety syndrome?
This is very important thing because when most of the time when vertigo happens, when dizziness happens, it happens suddenly for most patients. So when this happens, the person will be having a lot of difficulty standing by himself, walking by himself or herself.
Namaste everyone. Have you ever felt that the world around you is spinning, or is it you that is spinning? What exactly is dizziness? What exactly is vertigo? Are they same? Are they different? This is whether this is a neurological disease or whether this is something more than that. Today we are going to discuss the topic vertigo dizziness. I am very happy I am joined by Dr. Shafiqur Rehman, who is a experienced consultant neurologist and has seen numerous cases of vertigo or dizziness, whatever you call it as. He is going to explain to us what exactly is this, what causes this, and he is going to clarify various doubts or myths related to dizziness or vertigo. Thank you, Dr. Shafiqur, for accepting the invitation and joining this podcast. Dr. Shafiqur, can you tell us something about your background?
Thank you, Dr. Amitabh, for inviting me to the podcast. I am Dr. Shafiqur Rehman, a consultant neurologist. I have been trained in India and I have worked in India in neurology for a long time. And I have been working in the UAE for the past 5 years.
Thank you, Dr. Shafiqur, for the brief introduction. Let's get started. Dr. Shafiqur, what exactly is vertigo or dizziness? Are they same? Are they different for common people's understanding?
There is a slight difference between dizziness and vertigo.
Okay.
Dizziness is a general term. It's a simple English word used to mention various kind of symptoms. Vertigo is a part of that. There is a whole spectrum of symptoms. Dizziness is a colloquial English word used by many people, patients and doctors, to describe a sense of lightheadedness, spinning of the surroundings, sometimes blackout like feeling. So dizziness is a general word, it's a routine English word, whereas vertigo is a medical word. Yeah. Vertigo is exactly a spinning of the surroundings. Yeah. So when you feel like you are rotating or the surroundings are revolving around you, this is actually vertigo. It's a proper medical issue, which is a medical term, whereas dizziness is a general word where the patients are and everyone is describing a lightheadedness or vertigo or blackout.
So probably dizziness is something from simple man's
True. Dizziness is a
understanding.
general English word, whereas
Vertigo
is
may be
medical.
just a part of dizziness, but dizziness may comprise of many more issues in addition to vertigo.
True.
So frequently we hear ear is very important or maybe a culprit in vertigo or dizziness. So is it always middle ear or inner ear, whatever, or is it something more than that?
True. Vertigo is very commonly associated with ear problems. Like inner ear is the one that is associated with dizziness and vertigo. Inner ear contains fluid and some stones called calculi. So both sides there are stones and fluid. When there is an imbalance between the stones and fluid on in the inner ears on either sides, then this vertigo can happen. It is one of the causes of vertigo, but not all vertigos are inner ear problems. Okay. There are some brain problems that can cause vertigo. There are some problems related to medications that can cause vertigo.
Yeah. So vertigo or dizziness need not be just an ear problem. It can be more than ear problem, which may be related to a neurological or brain disease. You mean to say?
That's true. It can be a serious neuro problem, or it can be a cardiac problem sometimes. Or most of the times, it is a simple problem. It could be related to ear or other causes.
Yeah. So friends, understand that Vertigo, dizziness, it's a common conception or misconception probably that it is just related to ear. Yes, it can be related to ear, but it can be something more than ear diseases also, and it can be sometimes a sign of underlying neurological diseases. So, Dr. Shafiqur, for otherwise healthy people, what are the common reasons for dizziness or vertigo?
So in my daily practice, I see so many patients who come with dizziness. So most of the time, the dizziness is a very simple reason, like dehydration, anxiety, lack of sleep. So these are very common causes of dizziness. Most of the patients who come to our clinic have these one of these issues. But this is about in 80 to 90% patients. In 10 to 20% patients, we find actual problems related to brain or sometimes heart and sometimes ear related issues.
So, in your practice, like what percentage are actually simple vertigo or simple which can happen to any healthy walking, talking individuals, or is it always that there has to be some underlying disease in those patients?
I would say that in our outpatient practice in the clinic, about 95% patients around will be simple dizziness,
Okay.
whereas 5% patients may turn out to be having some problem related to brain, ear, or heart, and other medication related. Whereas when it comes to emergency, we see that more bigger percentage of patients will have serious issues, but still more than half of those patients are still simple vertigo.
So it's very reassuring to know that most of the people who may feel dizzy sometimes, most of the time it's not a very complex disease which you may be thinking about.
True.
But it is always better to get the attention of the expert and get it clarified. Dr. Shafiqur, frequently we have seen people feeling dizzy or giddy when they are getting up from the chair. Is it again same vertigo? What exactly is that?
It is a little different type of dizziness.
Okay.
This doesn't actually come under vertigo. So when a person gets up from bed or in a chair and is suddenly feeling dizzy or lightheaded, then the usual reason is it's called orthostatic hypotension in medical language.
Yeah.
That means the blood pressure has dropped when the person has gotten up from the chair or bed. This happens because of there are some reasons this happens. It is more common in older age people, slightly less common in younger people.
Okay.
And the most common cause of this is usage of some type of medications, like some blood pressure medications can cause this in the early days of usage. And sometimes dehydration can cause the problem. And there are some neurological problems that can cause this symptom. So whenever this is happening and if it is happening frequently, then the person is, it's better to meet a neurologist and get it evaluated.
You said the word dehydration. Now, frequently it is seen that someone who has a low blood pressure or is getting dehydrated for any reason, it may be diarrhea or in this weather in UAE heat, it can cause dehydration. So, does that directly cause vertigo or dizziness? What exactly is like what exactly is the reason, and can something be done to prevent that?
So dehydration is a very common cause of dizziness. When a person is dehydrated, the blood pressure drops because the water content in the body has come down. And when the person stands for a long period or stands from a lying position, suddenly there is further drop in blood pressure and they tend to get dizziness. Okay, it is more of lightheadedness than a typical vertigo. Sometimes it may become more severe also if the blood pressure has dropped further. Some people faint also. So the prevention is mainly one, you do not get exposed to very hot weather for a long period, and if you are getting exposed, drink lots of water and some salt containing drinks. So that will help prevent severe dehydration and dizziness and fainting.
So, friend, this is the summer season in UAE. Please stay rehydrated with adequate liquids so that you won't get dehydrated, and sometimes it can cause dizziness also. Now, Dr. Shafiqur, frequently stress or anxiety or some sort of similar diseases are associated with dizziness or vertigo. So, is it a fact or is it just the part of the stress or anxiety syndrome?
No, it is a very common symptom of anxiety. Dizziness is very common. Like when a person gets anxious, there is a reaction in the body called sympathetic system activation. So there is this adrenaline rush which happens, and this leads to symptoms like headache, dizziness. Sometimes people can feel little tremulousness of hands, tremors of the hands. So So dizziness is a very common symptom in anxiety in stressful situations. So it is always one of the diagnosis when we consider for a dizziness patient.
Thank you very much. So stress and anxiety also can cause, but it may not be having a separate reason. It may be just related to stress. So maybe once the control of stress is done with the medicines or whatever methods, it should settle down. Thank you very much. Dr. Shafiqur, there is a term called as benign paroxysmal positional vertigo or benign BPV, BPPV. Yeah, what exactly is this? We frequently come across that term while seeing the prescription.
Yeah, so it is called BPPV, benign paroxysmal vertigo. So this is a type of, it's one of the types of vertigo where the word benign is used. That means it's a simple problem. It's not a serious problem. So benign paroxysmal vertigo is where the stones in the ear, inner ear, they have changed their position, and the person is feeling revolving of the surroundings around him. This happens for a short period. The people get dizziness, vertigo for about 5 to 10 seconds, and then they become fine. Sometimes it can get prolonged to 10 to 15 minutes also, but rarely it is a chronic problem. It doesn't go on for days to weeks.
So the term benign itself means that it is not a very harmful condition. Does that
True. The benign, the word is used when it is a simple problem. It's not a serious problem, but the only trouble here is that when the people get this spinning sensation, then they may end up in accidents if they are driving, or if they are standing in a tall unprotected places, they may fall from there because the whole surrounding looks like it's upside down.
Dr. Shafiqur, next question related to the same issue is frequently people get dizzy when they are traveling in the car, or nowadays with the VR headsets which so many youngsters especially who are using. They do feel dizzy, giddy while using this or while traveling. So, what is the relation? Is it again a vertigo? What exactly is the reason for this?
This is called motion sickness.
Motion sickness, right?
Because when people are traveling, some people have this problem when they are traveling. It's called motion sickness. So this happens due to an imbalance between the inner ear stimulus, which is perceiving movement, but the eyes are positioned on a stationary object in the bus or car. So the ear is feeling the movement, but the eyes are not feeling that much movement. So this imbalance causes motion sickness, and people tend to get dizziness, sometimes nausea, vomiting. They may sometimes have profuse sweating. So this can be prevented by using medications, and there are some other methods also which can be used to prevent motion sickness.
So this motion sickness, I suppose it is a benign disease then in that case?
It's a very simple problem. It is stimulated by the motion, and once the motion stops, it stops.
Yeah, so that's again reassuring for people who get this motion sickness. It may not be something underlying complex disease. It just related to traveling, and it should settle down once the travel is done. Many elderly people get dizziness. So is it just a age related thing, and should be ignored to large extent, or we should always evaluate or investigate it in detail in old people?
Dizziness, as I said, it's more common in elderly people. Even vertigo is also more common in elderly people, especially people above 50 to 60 years of age. Because this is more common because of the age-related issues that happen with the blood flow from the heart to the brain, and also to the arteries that supply blood to the brain. And even in the the inner ears are affected more in the elderly people. So they have slightly more concerning causes compared to the younger population. So any elderly person, if he is getting sudden severe dizziness, or if he is getting a frequent dizziness, they have to visit a neurologist and get evaluated.
Yeah, so most of the time it may be just age related, but especially in old people, sometimes the things are unpredictable, and it is always better to get the expert opinion. Now, since most of our discussion is related to benign, simple, not very complex, but Dr. Shafiqur, I'm sure you have seen lots of such cases. So, can it also be a sign of something serious disease, underlying serious disease, whether it is a neurological disease, whether it is a tumor? So, I'm sure the percentage is less, but then If someone has something underlying disease, how do we get to it? Like, how do we identify it at earliest stage so that the investigations are started in time and the patient is benefited?
If a person is having a sudden severe dizziness and which he never had in his life, then it is better to visit the hospital and call an ambulance if he is unable to walk or drive, and get it evaluated. Because what we see is that in emergencies when patients come, so most of the time we see that this could be a simple vertigo also, but there are instances where people turn out to be having stroke. So whenever a person is having a sudden severe dizziness, then it's better to go to hospital, nearest emergency, and get a scan done to rule out any stroke. Whereas if the dizziness is long standing, persistent for going on for months to years, and it's not improving with the medications, then it can also happen with tumors of the brain or some disease called multiple sclerosis. It can happen due to inner ear, little serious issues of inner ear, like Meniere's disease. There is a disease of the inner ear, and it can also happen due to viral infections, which can affect the nerve permanently.
Yeah.
So and cause permanent dizziness. So it is always better if it is a severe dizziness or a long-standing dizziness to meet a neurologist and get it evaluated.
So, if it is a sudden onset or if it is not responding to the usual treatment going on for months or years together, definitely that is something we should not be ignoring and get an expert opinion immediately. So, if someone experiences a sudden onset vertigo, whether he is at home, whether he is at workplace or anywhere else, what do you suggest? What exactly he should be doing immediately so that at least the symptom is averted in time and it will not cause any complications?
Yes, this is very important thing, because when most of the time when vertigo happens, when dizziness happens, it happens suddenly for most patients. So when this happens, the person will be having a lot of difficulty standing by himself, walking by himself or herself. So the first thing I would advise is they need to sit wherever they are. Do not stand, do not walk, do not drive.
Okay.
Especially do not drive, because it can affect the person and it can harm the people on the road also.
Right, right.
So the person has to sit wherever they are, or if they are feeling severe dizziness, even in sitting position, to lie down on the floor and call the nearest person or take help of other people or call the ambulance and come to the nearest emergency to just to know the what is the causing the dizziness or vertigo and to get treated accordingly.
So, someone who suddenly develops, just stay where you are, don't complicate things, especially when you are driving. Definitely, you are not only like exposing yourself to the risk, but the other people on the road as well. So, better to stay where you are. Now, we have frequently heard in such instances something like a Epley maneuver is very useful. What exactly is that?
Epley's maneuver is a treatment method used for vertigo patients. This is especially used for vertigo, which is a inner ear vertigo. So this is a procedure usually done in hospital and under a professional guidance.
Okay.
So Epley's maneuver contains slight movements of the head by a professional and replacing the moved stones to their original place. So it's a type of treatment method. It's usually given in people who are not responding to medications. So it's a final treatment method for inner ear vertigo.
So then, as you said, it should be done under professionals' guidance. So if someone develops this symptom at home, so it should not be done. You mean to say?
I would advise it's not to be done at home, because sometimes during if the procedure is done slightly in a wrong way also, it can worsen the vertigo and the person can develop very severe vertigo and vomiting and severe imbalance, and a person may be unable to walk at all.
Yeah, yeah. So this is very, very important, friends. You may read Epley maneuver somewhere and you may attempt that at home, but please do not attempt that without experts' opinion. Now, can there be any lifestyle changes which can be implemented in these patients who are getting this vertigo or dizziness episode frequently that is going to help them in this at least controlling the disease without any medications?
True. Definitely, there are some lifestyle changes that can be used to prevent dizziness and vertigo. Especially, main thing is diet. In diet, I would advise people avoid coffee, high carbohydrate diets like sweets,
Avoiding
chocolates,
avoiding
avoid.
coffee is going to be a very
It's going to be very difficult
uh,
because especially adult population, working population is used
yeah.
to drinking lots of coffee, and children and ladies and are mostly sweets are their favorite.
Yeah,
But someone who has dizziness, troubling dizziness, frequent dizziness, vertigo, I would advise they avoid coffee as much as possible, and sweets and chocolates also as much as possible. Apart from that, with the daily activity in countries in seasons where it is very hot, so people get dehydrated easily. I would advise them to carry water and proper drinks with them to get hydrated very well to prevent dizziness. Apart from that, there is another precaution people have to take. One, when they are getting up from their bed, do not just stand immediately and go to washroom or something. Wait at the edge, sit at the edge of the bed, dangling the legs and at the edge of the bed, and move the legs for about 10 to 20 seconds. And then once you are settled, then you get up, so that the dizziness and fainting can be prevented, because this is one of the common things we see where people come to us fainted at home and the ambulance brings them, and the most common cause we see in these patients is that they just suddenly got up out of the bed in the sleep and then they fainted in the washroom.
So these are all simple
Precaution.
changes which you can do, like avoiding excessive coffee, staying rehydrated, especially in the heat or summer season, and especially old people. If you are like getting this dizziness on getting up suddenly, don't try to get up suddenly. As Dr. Shafiqur clearly mentioned, try to do it slowly, so that your body also gets adapted to your movement and the symptoms of dizziness or giddiness, and then the consequences will be avoided. Dr. Shafiqur, coming to the last question, this is the era of artificial intelligence, gadgets, smart age, smart mobile. Now we can see various apps in the mobile, balance training app, or various apps are there. I can't name all. All these things, like whether it is something like an app, simple as app in the mobile, you think it will actually help in someone who is getting this frequent dizziness or vertigo episode? If yes, then how they can use it?
So with the advent of technology, these days there are some gadgets and apps that help dizziness and vertigo patients, especially if someone is having severe motion sickness. So there are some apps in your mobile which you can download, and you can see where it will help with the movement. If they see at the edge of the screen, the motion sickness part comes down significantly, and the vertigo and vomiting can be prevented to some extent. And there are some apps which also help in nutrition, diet related advice, and they give feedback about the diet and the balance of the person. So these apps are helpful for some dizziness and vertigo
Yeah,
patients.
so this app, yes, definitely, if you used correctly, it will be helpful, but don't depend entirely on the app. Maybe to some extent you can take use of this app. It may control to some extent, but as Dr. Shafiqur clearly said, that many a times there it can be a sign of underlying diseases. So if it is happening frequently, or if it has happened all of a sudden, definitely you should go to the expert and get the opinion. Now this wraps today's episode. Whether it was dizziness, whether it was giddiness, whether it is vertigo, Dr. Shafiqur has clearly mentioned what are the reasons, what you can do at home, when should you pick up the warning sign, when should you pick up the clues that it may be something more than a benign vertigo. Thank you, Dr. Shafiqur, for
Thank you. Thank you.
explaining everything in detail. So, friends, please understand that your body may give you some clues or signs that it may be something more than a simple vertigo, in which case you should be taking the expert's opinion in time to avoid any complicated situation. The purpose of this podcast is to pick up the commonly seen diseases and try to understand it directly from the experts, so that there is no confusion. It is clarification of all the myths related to the disease. If you are suffering from vertigo or dizziness, or if any of your near and dear one is suffering from this disease, definitely this is the episode you should be watching in completely. Try to understand that. You should also share that with someone who is suffering from this disease, so that the medical attention is sought in time, and it will be controlled. If you have any questions related to today's episode for Dr. Shafiqur, please do write it in the comments. We will be very happy to answer those questions. If you want Dr. Shafiqur to discuss any other neurology topic in future, do write in the comments. We are very happy to welcome those comments, and we'll try to call Dr. Shafiqur as per his convenience. Do subscribe to the channel, and share it with as many people as possible, so that all this simple information, simple knowledge for general people's understanding is spread to as many people as possible. Dr. Shafiqur, thank you again for accepting and clarifying all the doubts related
Thank
to
you. Thank you for the
vertigo.
invitation.
Thank you. Thank you very much. Have a nice day.